Okay, so this is one of our series on sickle cell disease, and basically we want to go into the lives and the minds of children who have been experiencing sickle cell disease, what exactly they experience, and some of the things that they've done to hopefully come out of it, and what you can do to hopefully come out of it yourself. So I'm here with Nurudeen. Nurudeen is 12 years old, and Nurudeen has an interesting case. Nurudeen is 7 of 4 kids. They all have children. They all have sickle cell disease, but in addition, he has had a heart condition, and he also has the diagnosis on X-ray of his hip was query avascular necrosis of the hip joint. So he was already beginning to lose part of his hip as a result of sickle cell disease, and we've been seeing them now for about, Hajia, is it like five months now? I think it was November or December. December. So today is April 27th, 2018. So when we started seeing them, they were in pretty bad shape. They were always in the hospital, all 4. One of the 4, 2 of the 4, or even all 4 would be in the hospital every month. So, but in Nurudeen's case seemed to have been more severe. So I'm just going to have Eileen focus a little bit on Nurudeen now. Nurudeen, how are you doing?
Much better.
You're much better. Are you relaxed?
Yes.
You don't seem relaxed, but just shake it up a little bit, shake it up a little bit. Okay, so tell us how things were before you started coming to the center.
See, when I was not feeling
It's okay, you can do it, you can do it. For instance,
when I was having pain in my hip, before we met the NGO, Indian Embroidery Foundation, my hip was paining me that time, but now when we started taking the immune support and cardio for life,
the nutrients,
all the supplements, I can see that I have some changes in my body. Like I can play football now.
Well, you can play football now?
Yes.
Really? Actually, you let him play football these days? Really?
I play football, run around with my friends, play with my friends. But before, I cannot do these things.
What would happen if you tried to play football? What would happen?
I get pain in my leg and start feeling somehow like vomiting and
Pain in your leg,
yes.
feeling like vomiting.
Yes.
And
Then I'll now start feeling the pain. It's coming like crisis, but then before a minute like that, then it starts paining me very well. But now I've started feeling much better, and I can play with my friends, run around, play ball, all with the help of the immune support and cardio for life.
wow, that's fantastic. Okay, so was it only your hip you used to have pain? Did you used to have pain in other parts of your body?
Yes.
Like, tell me where.
Like my hands, my elbows, my hands, and my back.
And your back as well?
Yes.
Wow. Was that every day or just once in a while?
Once in a while.
Like once in a month, once in a year?
Once a month.
Once in a month at a time.
Yes.
And your mom said you used to be admitted in the hospital. Of the 4 of them, who was getting admissions the most? Nurudeen. All right. So, what was the reason they were taking you to the hospital?
Because I have the bone pain.
In the hip or where?
In the hip.
Okay. And what will they do for you when you get to the hospital?
They mostly admit me and give me drip and penta.
Penta.
To calm down the pain.
Did that help?
Yeah.
Definitely. But you didn't like having to go to the hospital all the time?
No.
Because you were missing school and you were missing football, weren't you?
Yes.
So what else can you now do? Football, you can play with your friends.
Ride bicycles.
You can ride bicycles.
Yes.
Nice.
And all with the help of the NGO with the supplement. Now we can play and jump with my friends, with my brothers. So now I'll thank NGO and their supplements.
Well, thank you very much Thank you very much. Would you have any advice for children like you going through sickle cell disease and having pains and problems?
I'd say like if children are having pain, they should sit them in their house and drink water.
They should drink water.
Yes, and relax.
Good. That's a really important point. Very, very important point. I think that's probably one of the most important things. But how about if they're in school and they're doing exams? Do you feel more crisis when your exams are about to start?
Yes.
Okay. So what would you advise them to do if they're having pains during crisis during exams?
They should also, let's say before they go to school, they should find like Panadol and drink and go to school with their. We mostly go with one bottle of water, but us we go with 2 bottles of water in case that one finished so that we can drink that one again. So I want them always they should be with their water.
Fantastic, fantastic. That's great, great advice. So you heard it, folks. Take lots of water. Give your kids lots of water. That's probably the one single most important thing you can do if you have a child with sickle cell disease. Ensure that they take lots of water, and of course, nutrients can help.